Good day to all. Today we will be showing about the urinary catheterization. Urinary catheterization, a latex polyurethane or silicone tube known as a urinary catheter, is inserted into the bladder through the urethra. It is used to drain the bladder. Definition: it is the introduction of a catheter through the urethra into the urinary bladder. Indications are to relieve discomfort due to bladder distension or to provide gradual decompression of a distended bladder. To assess the amount of residual urine if the bladder empties incompletely. To obtain a sterile urine specimen. To empty the bladder completely prior to surgery. To facilitate accurate measurement of urinary output for critically ill clients whose output needs to be monitored hourly. To provide for intermittent or continuous bladder drainage or irrigation. To prevent urine from contacting an incision after perineal surgery. To manage incontinence when other measures have failed. Types of catheter. First, Robinson or red rubber catheter. It is a straight catheter with single lumen tube with a small opening from the insertion tip, immediately removed after draining the bladder. Second, Carson count catheter. It is a double lumen catheter, non-rigid than other straight catheter. It has a tapered curved tip used for male with prostatic hypertrophy. Third one, indwelling Foley catheter. It is a double lumen catheter. Larger lumen drain urine from the bladder and smaller lumen used to inflate a balloon near the tip of the catheter to hold the catheter in place within the bladder. Fourth, three-way Foley catheter. It is a three-lumen catheter. The third lumen is to introduce sterile irrigating fluid. The fluid exits the bladder through the drainage lumen along with the urine, used for patients who requires continuous or intermittent bladder irrigation. Parts of the catheter and its tubings. Bladder opening, balloon, balloon port, urine drainage port. How to select the catheter? Based on the type of material and the length of catheterization period. Plastic catheter for short duration, like 1 week or less. Rubber or celastic catheter, period of 2 to 3 weeks. Silicone catheter, period of 2 to 3 months. Polyvinyl chloride, period of 4 to 6 weeks. Based on the gender, appropriate length of the catheter is determined. Adult female 22 cm catheter. Adult male 40 cm catheter. Based on the size of the urethral canal, appropriate catheter size is determined. For children, 8 to 10 French. Ideal size is 12 to 16 French. In case of hematuria size, 18 French. Based on balloon size. For adult, 10 ml to facilitate optimal urine drainage. 30 ml to achieve homeostasis of the prostatic area following prostatectomy. For children, 3 ml. Anatomy of external genitalia of female and male. In female, the catheter would be inserted through the urethral opening. The urethral opening is present in the vestibule above the vaginal opening. And in male, the catheter would be inserted through the urethral meatus. Now we will show the video demonstration about the female catheterization. The equipments are: sterile tray consists of steel kidney tray, 2 bowls, artery forceps, central hole towel, and a clean tray containing sterile gloves, lignocaine jelly, 10 ml syringe with sterile water, Foley's catheter with Eurobag, betadine solution, adhesive tape, and Macintosh. The preliminaries are: check doctor's order, prepare the equipments needed, explain the procedure to the patient, obtain the verbal consent, ensure privacy. Perform hand washing. At first, put absorbent pad or Macintosh under the buttocks of the patient. Positioning the patient. In position, Place patient in dorsal recumbent position with knee slightly flexed and feet about 2 feet apart. After hand washing, put on the apron. The apron is tied by assistant. Keep the hands away from the apron. Then open the sterile cover by maintaining proper aseptic techniques. Wearing sterile gloves. The gloves are put on sterile field. The pack is opened without touching the inside portion. First, wear glove on the dominant hand by sliding the fingers down. With the gloved hand, touch the inner aspect of the cuff. Slide down the fingers of the non-dominant hand. Then, the gloves can be adjusted. Cleaning of perineum. First, pour the betadine solution in the sterile bowl. Soak the cotton in betadine solution and start wiping the labia majora in one stroke. Discard the cotton. Again, soak another cotton in betadine solution. Then, we have to wipe the other side of the labia majora in one stroke. Discard the cotton. Separate the labia minora with the non-dominant hand and with one stroke labia minora of one side, discard, and with another cotton soaked swab we have to clean the other side of labia minora. After taking another cotton swab from clitoris to fourchette, at last a cotton swab dipped in betadine from fourchette to anus. Now we have to apply the sterile drape on the patient. It is to limit the exposure and to provide the patient with privacy. Place the kidney tray between the legs of the patient. By the help of the assistant, open the outer cover of the catheter. Open the wrapper at the tip. Apply the lubricating jelly on the gloved hand. Make sure the catheter is held with the wrapper on using no-touch technique. Lubricate the catheter well and identify the urinary meatus. Be careful not to insert the catheter into the vagina. Now, gently insert the catheter into the urethral opening until 1 to 2 inches. Open up the wrapper and check for the flow of urine to ensure that the catheter is inside the bladder. Now, we have to inflate the balloon with 10 ml of sterile water. Insert the syringe in the balloon port of the catheter. Push the 10 ml of sterile water inside to inflate the balloon. After that, gently pull the catheter back until you feel the resistance. Now, we have to attach the catheter to urobag or drainage system. Now, we have to attach it to the inner aspect of the thigh with an adhesive tape properly. Take the kidney tray out. Place the urobag below the level of bladder to maintain continuous flow of urine. In case If necessary, collect the urine sample. Cover the patient up and remove the drape. Ensure the comfort of the patient. Replace the articles. Perform hand washing. And now we have to document the procedure as per the policy of the institution. In documentation, we have to mention the time and date of insertion of catheter, amount, odor, color of urine, size of catheter used, how much sterile water injected to inflate the balloon, and the name and signature of the person performing the procedure. Now, procedure for male catheterization. Prepare the equipments needed. Explain the procedure to the patient. Obtain the verbal consent. Ensure privacy. Position the patient supine position. First, perform hand washing. Put on the plastic apron. The equipments are sterile drape, gallipot, catheter, water for catheter balloon, sterile gloves, catheter bag, adsorbent pad, sterile receiver. For the cleaning of the male genital region, at first, hold penis with non-dominant hand using sterile gauze and ensure patient foreskin is retracted with your dominant hand. Then, clean the area surrounding the urethral meatus. The direction of cleaning should be away from the urethral meatus. Place sterile drape over the patient genital area. Drape area surrounding penis. Place sterile kidney tray below the penis. Hold the penis vertically with non-dominant hand using sterile gauze and inject the anesthetic gel into the urinary meatus and continue to hold the penis in position to ensure the gel remains in urethra and allow 3 to 5 minutes so that it reach its maximum effect. Open catheter wrapper, ensuring not to touch the catheter tip. Inform patient while inserting catheter. Insert the catheter gently. Grip the penis to prevent slipping and check for drainage of urine. Inflate the balloon with 10 ml of sterile water and pull out gently the catheter until resistance is felt. Attach the catheter with urobag or drainage system. Place the urobag below the level of the patient bladder to ensure continuous flow of urine. Clean up the patient and dispose of equipment and gloves. Cover the patient and provide comfort. If necessary, collect urine sample. Wash hands thoroughly. Documentation. Collection of urine sample. Perform hand hygiene. Wear sterile gloves. Clean the surface of urinary catheter with spirit swab. Clamp the drainage tube for 10 to 15 minutes before collection. With insulin syringe or 2 cc syringe puncture the catheter port and draw the urine. Transfer it to sterile container. Label it as catheter specimen. Thank you.